Welcome to my today's presentation, OBSiDiAN RFT, Regenerative Fistula Treatment. My name is Thomas Geier. I'm the CEO of Revolution GmbH based in Rosenheim, Germany. It's a great honor for me to introduce you into this new interesting topic in fistula treatment. What can you expect when you use OBSiDiAN RFT in your daily practice? So we are talking about regenerative medicine, as our product is fully autologous biomatrix gained from patient blood. We do stimulate the autoimmune system, and therefore it is a maximum support for the self-healing competence of your patients. It improves and accelerates the healing of the fistula tract. It is a minimal invasive and reproducible procedure, surgical procedure. You do completely fill the fistula tract. It's air and liquid tight. And the co-delivery function, which I will explain a little bit more in detail later, allows you to co-deliver with our biomatrix, stem cells, drugs, or any other liquid substances with our biomatrix. So what is inside? What is OBSiDiAN? OBSiDiAN RFT contains 40 different growth factors, which are stimulating the autoimmune system. This is important for the tissue regeneration, and very important, our product is thrombin-free. As we take 120 ml of patient blood, you can see that we have a really high concentration of platelets per milliliter, and also it contains cytokines and chemokines. This is 7 to 10 times higher per milliliter as normal. All these different growth factors play an important role as they initiate and coordinate the healing process. In different time points, starting from the adhesion when you created a wound until the wound is closed, they play a very important role. The adaptive immunity is also a quite important topic, as the platelets do interact with antibodies. They bound to immune globulin opsonized bacteria. They release antimicrobial peptides like psoriasin or HPD2. They secrete pro-inflammatory and pro-coagulant mediators, and those again initiate the adaptive immune response of our immune system. Also impressively proven by Professor Bayer from the University in Kiel was the importance of time kinetic. Our platelets are protected by a fibrinogen 1 biomatrix and are released over a time period of 5 to 7 days. And this makes the real difference, as it takes some time until the immune system gets really triggered. And then on day 2, 3, 4, 5, there is a maximum effect. And that makes our product so unique. Also, as mentioned, our product, as you can see here, is thrombin-free, because thrombin really destroys the cell membrane. And as you can imagine, this has really a bad influence on the healing process. So that's why OBSiDiAN is completely thrombin-free. So how does it work? We created a complete protocol of treating the fistula, as it is a very complex disease. We have built up a complete treatment protocol starting from identifying the fistula tract, cutting out the outer ostium, then do an intensive debridement. In our set, you will find a special debridement device that allows you a sufficient debridement and to get the fistulated tissue out of your fistula tract. Afterwards, we do rinse the fistula tract with warm solution, because cold water would also make the wound inactivated for at least 2 days. After, we developed also a special catheter, a straight catheter that allows you to introduce it into the fistula channel and also fill the side channels of the potential side channels of the fistula. And later, when you have done this, we close it, and the rest of the material will not thrown away. So we use everything we get out of it. So you put it in a syringe, and then we make several depot setting around the inner ostium, that the healing process is also triggered from the healthy tissue. And also it takes some pressure of the inner ostium closure, as this is more or less always at the high pressure soon. More information you will find at our homepage on www.revolution.de or at our YouTube channel at Revolution GmbH at YouTube. So to summarize, what are the product benefits? So OBSiDiAN RFT contains a high concentration of fibrinogen 1 of 25 milligram per milliliter, which is important for hemostasis. It's 7 to 10 times higher concentration of platelets. It contains also protein like cytokines and chemokines. It's a high elastic and very user-friendly, 100% autologous. The fistula tracts are completely filled, so there is no risk for a reinfiltration of bacterial from the colonic side. We do perifistulated depot injections to support the healing from the healthy tissue. There is the opportunity of co-delivery of certain substances like stem cells, antibiotics, and other drugs. You have no foreign body reaction. OBSiDiAN will be completely dissolved within 7 to 10 days due to the body-own proteolysis. And it is the autologous army in the fight against colonal bacteria inside the fistula tract. So finally, what do you need in order to prepare OBSiDiAN RFT? You need a system, two components, a processor and an applicator system manufactured by Vivostat AS based in Allerød, Denmark. How does it work, or how does the product be manufactured? So you get one kit, it contains all the components. So you have a prep unit. In this prep unit, first we fill, as you can see here, you first fill in a tranexamic acid for the stability of the product and the citrate in order to avoid the coagulation of the blood. You go then to the patient side, take the blood, close the system. Then you put into the system a pH 4 buffer, and in this syringe later on there will be also the final product when the process is finished. You go to the processor unit, and it's a fully automated process, and after 40 minutes the product is finished. As mentioned before, our system has the co-delivery option, meaning when you look to the head of the system, you have here the air, and here is where OBSiDiAN takes place, then a pH 10 buffer, which we need that it is starting the quick polymerization process, and the third channel where we can then add on a certain substances, as seen here, like SVF, bone marrow stem cells, or you have skin cells like keratinocytes, drugs like antibiotic, cytostatics, and other substances. Also from the applicator systems, we have all the surgical treatments we can do with OBSiDiAN, but mainly for the fistula, we developed a straight co-delivery applicator that allows you to treat all type of complex fistulas in that manner. So finally, to say OBSiDiAN RFT and regenerative medicine is a very new field in surgery, and it has a lot of opportunities that needs to be evaluated. So I would like to thank you for your attention, and stay healthy. And I hope that we can see each other soon in your practice for a first test of OBSiDiAN RFT regenerative fistula treatment. Thank you very much, and goodbye.